Hi guys, here's Paula, the crazy ozone lady. Welcome to another installment, another live stream. And today I will talk about the risks, complications, and contraindications of DIV ozone injections. So I'm here to bust some myths and to set some things straight, and just in general to offer people useful information about ozone therapy. And if you're wondering why I'm wearing the neck brace, that's because I have cervical instability, and this helps me deal with the symptoms. But I have no pain, so it just looks really a little dramatic. But I'm actually doing pretty fine. All right, so let's get right to it. And I have prepared a little presentation here. So, okay, so what are the risks of DIV ozone injections? The first risk, and the most serious one, is death. And this may surprise some of you. Others may be vindicated. Others may think, I knew it, it is dangerous. And others may be incredulous, especially those who have been following Dr. Robbins, who recently in one of his interviews, one of his videos, he said that yes, there can be complications occurring with DIV ozone injections, but gas embolism is not one of them. And yet here I am to say that no, he is actually wrong, that yes, gas embolism can occur during DIV ozone injections, and even death. And so some of you may be asking, who am I to question the great Dr. Robbins, who has performed over 300,000 of DIV ozone injections or more? And so who am I? Well, I'm someone who has hard evidence. And so let me show you what I mean. And what I mean by this is here, this excellent blog post by Ben Whitmore on the Briar. And what he has done, he has apparently translated a book from 1986 that was published in Germany. So this is the original book, and in German. So it says Outsider Methods in the Medicine, and one of the chapters deals with ozone therapy and with the complications and problems that occurred due to ozone therapy. And so that publication cites 6 deaths that have occurred due to ozone injections. So yes, this is definitely real. So you can kill someone by injecting ozone into their bloodstream. And those are all very well documented cases. Now what I mean by well documented is that those injections were performed by practitioners, either by alternative health practitioners or by medical doctors, and it was known that this is what was performed. So they legally and officially were administering DIV, so intravenous ozone injections or intra-arterial ozone injections into their patients. So there was no doubt about it, and there were also autopsies performed. And so we know conclusively that the death occurred after the injection of ozone. And so this is really important to stress for me, that those were really well documented cases, because there's a lot of other misleading information circulating on the internet. There are stories where it's described that some practitioners in a private apartment, they pulled out some container with some liquid and then injected that liquid into a person's vein, and this is cited as a case that ozone injection caused the death. But of course, ozone is a gas, it's not a liquid, so it couldn't have been that. But all those 6 cases are really well documented. But it comes with a but. So not all of those 6 cases have actually occurred after intravenous ozone injection. So one of them occurred after intra-arterial injection. So this was the injection of ozone into the artery, not into the vein. And so this is a much more complicated, much more difficult thing to perform. And as far as I know, no one does this anymore anywhere. Intra-arterial ozone injections, this is not something, this is a completely obsolete method. Another of those 6 deaths occurred after the injection into the tissue. So it was either a subcutaneous or intramuscular injection around an ulcer on a leg. So it's not really clear whether one can classify this as a intravenous injection. Maybe by accident the practitioner injected into a vein without knowing this, but the autopsy did not reveal any signs of a gas embolism. But it's still possible. Another death occurred 3 weeks after the person was injected with ozone. So the person was injected with ozone intravenously, collapsed, then had some neurological deficits, was hospitalized, and then 3 weeks later died due to pneumonia. And yet, nevertheless, the author here attributes this case as an ozone death. And it's possible because the autopsy revealed certain signs which were also present in other people who died due to DIV ozone injections. So it's possible. But so between 3 and 5 people died in the 70s and 80s in Germany due to intravenous ozone injections. So this is definitely real. Death is definitely a possible complication. And another thing is loss of consciousness. So there are probably more cases of people who have lost consciousness after an injection with ozone intravenously. So this is another possibility, and it is assumed that this is also due to a gas embolism, because when oxygen gets into the brain, into the blood vessels of the brain, and is not absorbed quickly enough, then it will block the circulation of blood, and then this can cause loss of consciousness or people passing out. Another thing that has occurred after certain DIV ozone injections is blindness. And in some cases this was temporary, in other cases this was permanent. So this is also another real complication of DIV ozone injections that people need to be aware of. Another is lung distress. So this is the sensation of not being able to breathe properly, or sort of like a pain when one tries to take a breath. And it is sometimes accompanied by a cough. So this is also pretty common. This is not a rare occurrence, and it is also assumed that this is due to embolisms, microembolisms in the lungs. And this is also observed in people who receive Oxyvenierung. Now, Oxyvenierung, this is the art of injecting pure oxygen intravenously, and this has been performed for the past 60 years here in Germany. And so this is a known occurrence, a known side effect of injecting either ozone or either oxygen or an ozone-oxygen mix intravenously. So this can happen, and usually it passes after 30 to 60 minutes after the injection, but it is very important that if it occurs during the injection, that one should stop the injection immediately. And usually it passes like within 30 to 60 minutes. In rare cases, it can last a little longer, several days. Another pretty common problem is phlebitis. So this is inflammation of the vein. So the vein will get red and painful and hard. And so this is also something that I talked about in another video, and how to prevent this. And the main way to prevent this is by using low ozone concentrations between 25 and 35 micrograms per milliliter, to not go above that. So phlebitis, so yes, this is an inflammation, so it can be painful, it can be very uncomfortable, but it is in general not dangerous, and usually this passes within either a few hours or a few days. The problem with phlebitis is that if it occurs regularly and repeatedly, then this can lead to scarred tissue and to sclerosed veins. So the veins can collapse, and it's possible that it will be very difficult to inject them in the future. Another possibility is an allergic shock, and this is something that I did not believe in for the longest time. I thought that this is a myth, that there's no such a thing as an allergy to ozone. And yet I had to come to the conclusion that yes, it is real, because I had seen this on a person that is very near to me that I had treated with DIV ozone injections. So, the person did not go into a shock, but there was an allergic reaction. And a possible explanation for this is that we know that the injection of pure oxygen can trigger the increased production of eosinophils, which are white blood cells. And so it's possible that DIV ozone injections will just make the body produce too many of those white blood cells, and this could then create an allergy. This is just speculation, a possible explanation. Another thing that can happen are neurological deficits like memory loss, memory loss, dizziness, and confusion. And this is most likely because of microembolisms also in the central nervous system. So those are also things that have been observed and that have been discussed in this publication from 1986 in Germany. Paraplegia is another possible complication. And the paraplegia, that means this is either a loss or an impairment of movements, and this is also something that has been observed. Paraplegia up to paralysis. So those are all things that can happen after DIV ozone injections that have been actually observed, documented, and that we know of them, that they have definitely occurred. All right, so let's go to contraindications of DIV ozone injections. When should one not perform them? And there are a few conditions where ozone and also DIV ozone injections should not be performed. One of them is an allergic reaction to DIV. So, okay, but now here's the question, well, how do I recognize that this is an allergic reaction, not a Herxheimer reaction or some other adverse effects? And this can be tricky. But I would say, look out for any typical allergic reactions like itchiness, redness, swelling of the tissue, swelling around the injection site. Those can be indications that there is an allergic reaction going on. And so if you have a suspicion that either you have an allergic reaction or someone you injected, then I would not continue those injections. Now, the person that I observed an allergic reaction to DIV ozone injections, the interesting thing is that person, well, it's my dad. So that person, my dad, he is able to do any other type of ozone treatment. He's fine with ozone saunas. He can do the ozone bubbles, breathing ozone bubble through olive oil, and so he can do those treatments, and he's perfectly fine, except with DIV ozone injections. So we had to stop those. So the way to also prevent an anaphylactic shock, what I suggest is that what one can do is to first inject only a very small amount, so just 5 cc, and then see if everything's fine. If everything's fine, then one can increase slowly, but by 5 cc or not more than 10 cc with each injection if one wants to move really, really carefully. Another contraindication is any type of medical emergency like stroke, heart attack, physical trauma, or an asthma attack. So if you see someone lying in the middle of the road bleeding because he has been run over by a car, You don't grab your ozone generator and perform a DIV on them. No, you call 911, of course. And the same for someone who you believe has a stroke or heart attack. You call 911, you don't do a DIV ozone injection. Another possible contraindication, clear contraindication is internal bleeding. So DIV ozone injections, ozone injections in general, they can stimulate the blood circulation, and if there is internal bleeding going on, then this is the last thing you want. Another is hyperthyroidism. So, but here also it comes with a caveat. So if the hyperthyroidism is not well controlled, so if the person is not taking medication and where this is just not well medicated or controlled, then any type of ozone treatment could trigger a crisis, because ozone is known to stimulate hormone production. So if someone already produces too much thyroid hormones, then of course an additional even more of that hormone can trigger a crisis. So one should also be careful with this. Now, other considerations before DIV ozone injections are, for example, G6PD deficiency. And so this is something I wrote about on my blog. So there's a number of practitioners, a number of doctors who actually require a G6PD test before they treat their patients with ozone therapy, because it is assumed that people with this deficiency, that they could develop a very severe reaction to the ozone. Now, I want to stress that this is, as of now, this is a theoretical contraindication or a theoretical consideration, because I do not know of a single case where someone with this deficiency, the G6PD deficiency, who did ozone and then developed some problems. But it is possible that this is still a real thing. So if you're not sure if that's the case for your case or someone you're treating, then better don't perform the ozone injection, or just start with very, very low amounts. Another possible theoretical consideration is eosinophilia. So this is when there are too many eosinophils in the human body, and this can be present in people who have asthma or autoimmune conditions. And we know that the injection of pure oxygen intravenously will trigger an additional production of those white blood cells. And as I laid out before, so this is certainly also true for DIV ozone injections, because if you inject ozone intravenously, only a very, very small amount of this is actual ozone. This is between 1 and 5%, and the rest is pure oxygen. So one has to also assume that also DIV ozone injections will trigger an increased production of eosinophils. And if there already is a eosinophilia present, then this may cause problems. Maybe this is what could explain the development of allergies in some people to DIV ozone injections. But it's also perfectly possible that DIV ozone injections could actually help in this case. So it's possible that they could lead over time to a reduction of the eosinophils and to the symptoms, because people who suffer from asthma or autoimmune conditions, they often suffer from chronic inflammation, and ozone, of course, is a potent anti-inflammatory agent. So this is still not clear, but this is again another theoretical consideration that it may be good to keep in mind. Another are varicose veins, and that's because there is apparently a higher risk of stroke in people who have varicose veins, and that is because there are blood clots that that are sometimes formed in those bulging veins, and then those blood clots, they get loose, and then when they find their way to the brain, then a stroke can occur. So it's also possible that someone who is maybe already in the process of developing a blood clot then does a DIV, and the DIV somehow helps that blood clot along, and just like is that thing, that force that actually releases that blood clot. And then of course, if a complication happens, then it will be attributed to the DIV ozone injection, not necessarily to the fact that the person was already at risk of having a stroke or not. But on the other hand, DIV ozone injections performed into varicose veins, they work really fabulously for varicose veins. So you can very, very well treat varicose veins through the injection of ozone at high concentrations between 50 and 50, 60 or 70 micrograms per milliliter. And this works very reliably and really shows great results. So it's possible that by treating the varicose veins over time, you will actually reduce the risk of stroke in the person who is receiving the DIV ozone injections. So those were the most important points. So some of you may be surprised, some of you may be shocked, but here's the thing, one needs to keep the thing in context. And by the way, also, so this live stream that I'm doing right now, this is as an accompaniment to an article that I'm writing. And so in that article, I will really go into the details, and I will also show that yes, although those things are really serious and they're real, and they occur and they have occurred in the past, they're actually extremely rare, number one, and number two, there are mostly because of an obsolete form of DIV ozone injections that were practiced in Germany 40 years ago. And as far as I know, no one uses that obsolete DIV method currently anymore. And I also could not find any well-documented cases of anyone having been killed by DIV ozone injections in the past 40 years. And why that is, I will go into details in my article. So if you want to be notified when that article will be published, just go to the following link. Just type in thepowerofozone.com/news, and you will be directed here to this page, and just type in your email, click on subscribe, and then confirm your subscription by going to your email account. So if you want to be notified when the article gets published, just subscribe to my newsletter. And so because the questions, of course, as you have seen, those deaths that occurred, again, those well-documented deaths, it was like a cluster that occurred all in the same time. They occurred in the 70s and the 80s, and they occurred all in Germany. I could not find any other such well-documented cases of people who have died after ozone therapy in any other country at any other time. And so some of you may say, but what about those two guys in Las Vegas? Well, this is why I'm stressing well-documented. Because yes, so there was this case of two guys having met with a woman and her daughter in a private Las Vegas apartment, and apparently a DIV ozone injection was performed twice. One time the woman was perfectly fine. The next day the injection was performed, and apparently it was performed by the daughter, not even by one of the men. And then she collapsed, was hospitalized, and later died. But here's the thing, that those two men, they deny that they have done that. So we don't really know what happened. So this is why I'm saying this is not really well documented. We don't know what happened. We don't know what really was injected. We don't know whether it was the daughter who injected it or the two men, and so on and so forth. I also could not find evidence that those men were actually imprisoned, so convicted and imprisoned. So my point is, those deaths that occurred, they all occurred in Germany. And so far I could not find any other such similar cases, and I think there is a very good explanation why that is. So fact is that DIV, they have been performed over 300,000 times by Dr. Robbins. Dr. Rowan apparently also uses DIV. I don't think he uses it as often as Dr. Robbins. There's another doctor in Colombia that I know of who's using DIV, another one in Mexico. I have been using it for the past 10 years. There's one man in New Jersey who has been practicing for 30 years and who has been injecting really thousands and thousands of people with DIV for the past 30 years. And there's a similar individual on the West Coast. Those are kind of like underground practitioners. That man on the West Coast also, he says he performed probably around 30,000 DIVs over the past 20 years. And all those people in the past 30 to 40 years, not one single death has occurred. So it's definitely, so the deaths that I showed here, they definitely have to do something with how DIV was performed in Germany at that time. And currently no one uses that method anymore. And that method, that obsolete German method, is described here in this book by Dr. Wolf. The book was published in 1979. And there's also a picture of him applying this method. Let me show you here the picture, you see. And this is, and again, I will explain this further in the article that will be published in a few days. And so this is that method that he applied, that he designed in order to prevent embolisms from happening, but it had exactly the opposite effect. So I believe that was a problem. So yeah, so the bad news is what you should be taking away. The bad news is, yes, you can create huge problems up to death in someone by injecting pure ozone oxygen intravenously. The good news is it's pretty difficult. So you really have to go out of your way to do this. And the good news is that those complications are extremely rare. But so another very important thing to take out of this is that yes, there's definitely a right way, a correct way to do DIV ozone injections, and there is a wrong way to perform DIV ozone injections. And this is the difference between the right and the wrong way. This is what makes it either safe or dangerous. So it's like the same thing as when you drive a car. You just don't jump into a car without someone having showed you how to do this. No, you first get someone who is knowledgeable and can instruct you and teach you how to properly and safely drive a car. And only then do you jump into the car and then go on the highway. So it's exactly the same with DIV ozone injections. You want someone knowledgeable, you want someone who is experienced to show you how to do this safely and correctly. So I hope this was helpful. Thank you very much for tuning in. I have some pork ribs and some chicken legs in the oven. They smell delicious already. I can smell it right now. So I'm gonna go and devour them. So again, thank you very much for tuning in and see you in the next video. Bye.